in terms of myself, yes, my name is Florian Juergens. I'm the Global Social Protection Advisor based in London, but kind of working with various with our network members and country offices kind of around the world. I spent the last couple of years in Malawi, so I'm a little bit more familiar. Actually, that's why I'm happy to talk to you about this region in particular. I have some kind of experience, familiarity there. But I just wanted to give you one caveat that I'm not an expert on open data. I work in social protection. That's my kind of field of expertise. And obviously through that work, I work a lot with data, with data. It's an incredibly important part of our work, and it really informs a lot of the discussions, and kind of activities in social protection. So I think that's the way I want to look at this presentation, that I'm a social protection specialist. I will talk about social protection for older men and women, and particularly older women. What are kind of trends, what's happening in the region, what are some challenges? And through that conversation, I will reflect a little bit around, what I see as kind of the role of data, some of the shortcomings, and then in the end, share some thoughts on how to improve kind of the quality and role of data in social protection. But again, you guys are the data experts. I'm coming in from a social protection perspective. So I just wanted to share that. Okay, don't want to waste more of your time, so let's just get into it. Hold on a second. How do I switch slides? I cannot. There you go. Okay, so very quick outline over my presentation. I want to start a little bit with giving you a brief picture of population aging, then go into our kind of a snapshot of our knowledge about social protection for older men and women, or the women and men. Have a little bit of a reflection of our thinking, HelpAge's thinking, and many other actors' thinking on the standing of older women in social protection systems, in pension systems, and how the design of social protection system either enables and empowers them, or can, in fact, if designed badly, hinder their societal participation, their well-being, and not be reflecting of their needs and rights. So this is, again, this is all kind of framed around the CSW and the conversation that we're having, and that many others are having as well. So I will draw on that quite a bit. Then I'll talk a little bit about data and data availability issues, and then a quick reflection of what do we think of better data? And it's interesting that one of the colleagues on the call already mentioned the inclusive data chapter, which is something I want to kind of highlight. I will close the presentation by sharing a few databases and resources around aging, inclusion, and social protection. That if you want to follow up some of these points I raised, these are good kind of starting points for the best data we have on those issues. Right. So aging. I don't want to spend a whole lot of time on it, but I think it's important to realize it's a global phenomenon. It's happening in every country, in every continent, in every part of the world. There may be different speeds, and some countries are maybe aging faster than others. But it's something that we all share as a process we go through kind of in our development. I think, and I think it's important to realize it's a very positive development. I think, that people live longer. This has a lot to do with advancements in health, I guess poverty reduction, general development. So in a way, the fact that the world is aging is something to be celebrated. That doesn't mean that we don't have to get ready for it and adjust systems, particularly in the world of social protection, but it's not, in of itself, I think it's a very positive thing. And focusing on on Africa here, we see that, it has at the moment, I think, the lowest percentage of older people in this particular graph from the World Population Prospects, the UN. They say it's about 5% of the regional population in Africa is 60 and older. This from 2017, so it's relatively up to date. But this number, while being... Excuse me? Sorry, am I...
Nesta's mic isn't muted.
All right. I'll just continue.
Yeah.
Okay. So just to say that, this is something, it's not an issue for Asia or Europe. Population aging is happening everywhere, and something we have to be aware of, and something we have to prepare for. So what does that all So what does this mean for social protection systems? So this is going to be, this was kind of an introduction. I'll talk now about pension systems more generally. We know that pensions are the most popular element of social protection. Usually when countries develop their pension system, their social protection system, pensions is something historically where they start with. It's, there's usually a societal consensus behind it that all the people deserve and require some level of social protection. It's often a relatively small group of the population, so it's doable for all countries at all levels of development. So it is the most prevalent form of social protection in the world. And about 70% globally of older people do receive some form of pension. There's a whole other conversation whether that's adequate, is that enough, is that something that it realizes rights and allows to live a life in dignity, but there is good coverage. However, there's massive geographic differences here where in the Americas, North and South, Europe, Central Asia, there is usually almost universal coverage of pension systems. Obviously, these systems have grown over a long period, and were essentially invented 100 years ago in Germany. But so there's been time. But there are countries and regions where very, very few older people actually do receive a pension. Sub-Saharan Africa in particular, but also Southern Asia, the Arab states, interestingly, have very, very low pension coverage. And obviously that's a tremendous problem, not just for the older people who have no income security, but also for families who will have to kind of fill that gap. And we've seen, I think, in a lot of places how kind of traditional systems of care and support are no longer as robust as they may have been in the past with urbanization, with migration, with changes in kind of labor markets and work, and also cultural changes. So the lack of a pension system is, economically speaking, I think it's something countries can afford and can't afford not to have. But not only are there geographical differences, there's also differences between men and women. Around the world, with few exceptions, women are less likely to receive a pension. And if they do, in many, many countries, and certainly most countries, they have lower levels. So consistently around the world, women are less likely to have a pension and less likely to have adequate or likely to have lower benefit levels than their husbands or male counterparts. And even in countries where there's widespread pension coverage, the benefits considerably lower. This is not something that is confined to maybe low and middle income countries. This is a picture we see everywhere in the world. On the next slide, we essentially see the percentage of people above retirement age. That can vary from country to country, 60, 65, 67, depending where you are. And what percentage of that population receives a pension? We can see that there's some countries to the right where essentially everybody has a pension, and there is no real gender difference in countries like Mauritius, Botswana, but also European countries, Germany, Lithuania, France, Sweden, those places. But in countries where coverage is not universal, where not everybody has a pension, in the vast majority of those places, women have lower pension coverage than men. This is something we observe, throughout the world, and this is based on ILO figures. And then in the same slide, the same picture is presented on the next slide, where again, this is a snapshot of countries. What do we have here in Africa? We have Mozambique, Burundi, Botswana, and then Egypt, North Africa, and in all those places, hold on a second, what's the, wait, I'm sorry, now I'm confused. I don't see the, wait, which one are men? Okay, men are the purple, sorry. Men tend to have much higher, even where we can see that pension coverage is very, very far from universal. Men tend to be the ones that have a pension, and that pension is likely to be higher than that of a woman. And that's and I think, speaking of data, this is something you we as a social protection sector can only realize on the basis of a good understanding of coverage, of adequacy, what are the transfer levels. This data needs to be disaggregated, to be able to see gender differences. So that's what, in a way, that was my point I was making earlier, that I'm not an open data or data expert, but I work with data in kind of understanding social protection systems better, and thinking about where are there gaps and where is there opportunities to improve those. Okay, now I'll have 2 slides where I want to talk a little bit about why that is. And since we're talking about data, I try to include the links at the bottom of the presentation, where you can kind of follow up on those. I wouldn't want to give a presentation on these things to a data audience without backing it up with reasonable data. I know there's a lot of text, I do apologize, but I'll try to be quick. It's a general kind of boilerplate statement in social protection that men and women and various, in various population groups are exposed to different risks and vulnerabilities, advantages and disadvantages, which may be specific to the gender, to their age, to their various abilities, and that's something they face in their lives. And for women, in many places, there's that we experience in women around income, around pension coverage, on comes. That is, I think there's a good understanding that this is based on multiple and interconnected discriminations, inequalities, various forms of discrimination, discrimination in the education sector, wage differentials. We all talk about the wage gap, which is a reality for women around the world. Gendered work norms, about certain expectation that some jobs are just for men and others are for women. But all these discriminations that create inequalities. And I think very, very interesting is part of that expectations around kind of about unpaid care at home, and the host of responsibilities as women tend to have that men don't have, that place that are unpaid, often unacknowledged, unappreciated, but that tend to put a lot of extra burdens on women's kind of lives and days, and but are not, and that's crucial, compensated or facilitating access to social protection. It's not a job. You go to the factory and you work, and you get social security and potential and a pension, essentially in return. But it's work that is unacknowledged, unpaid, but expected of many women around the world. Unpaid family care responsibilities, and that's seen as a major obstacle to to kind of a more fuller participation in the labor market and access to social protection, income, empowerment. I think this is not to say that this kind of care work is not important. The opposite, obviously, it's incredibly crucial for societies and families. I think the point here is that it's often gendered and acknowledged and unequally distributed. This is, this leads to the fact that this lifetime of disadvantage and discrimination, unpaid work, that often women around the world, are women throughout their lives tend to be poorer than men. It's very difficult to analyze that, because often we have household level data, and then how do you go from there to individual poverty lines? But I think what we know is that women, and I think that resonates well with what we know about the world of work and the kind of labor markets, education opportunities. I think that resonates well with that. So there is a tremendous need for not just universal social protection, but also gender equitable social protection that recognizes that around the world, women are expected that work and income and education is gendered, and that that needs to be taken into account when designing social protection systems. We can't just assume that the single job for a career in the formal economic sector, kind of the picture, the kind of the factory worker that works 9 to 5, unencumbered by additional kind of responsibilities, that's representative of you know of many women's lives. I think this assumption is invalid. And again, this is this is a finding that's based on data, and that's based on an understanding of labor markets, of income, of enrollment in social security schemes, in an analysis of wage differentials, education differentials, pension levels that differ between men and women and older age. So all of that is, without data, we wouldn't be able to say any of this. And I think it's incredibly crucial that we are able to say that social protection is severely need for the women, and that it needs to be designed in a gender equitable way. Finally, okay, so the point I think I always want to make when talking about social protection in the context of kind of gender discrimination and the various intersecting inequalities that women and various other population groups think of, people with disability, population groups that are marginalized by society, that they face. It's crucially important that we have policies that address the root causes of gender inequalities in education and employment, addressing unpaid care, and that's addressing the root causes, and that's kind of the foundation of it all. But it is also really important that the social protection systems, the system that ensure income security throughout the life cycle, a life course, that those are designed in a gender sensitive manner. It will not, a gender sensitive social protection system will not fully be able to make up for discrimination through the life course, but it can mitigate and reduce the negative consequences. So you will need both. And I think addressing the root causes is absolutely critical. But it also really means that we need to design our social protection system, and in particular our old age pension systems, in a way that are more reflectant of older women's lives, particularly in lower middle income countries where formal employment is very, very limited, largely limited to men. I think that's an element, and where the work that women do is not recognized in those. Whew, okay. So then we get to, I think, a very, very positive development, and that is the rise of universal social pensions, tax-funded. These are, I'd like to think, a policy response to an accumulation of evidence that the current systems of social protection don't reach those most in need of them. That social security systems, as they're currently designed, with their link to employment, formal employment, that they are, while incredibly important, and effort should be really made to see how those can be expanded to the informal economy. That's really important, but that those systems in the medium-term future will not be able to provide at least basic income security in old age, certainly not for women, in many, many places. And we see that countries that have implemented these social pensions, which are essentially simple tax-financed transfer given to older people at a certain age level, they are really, countries that have done those have been able to address and to kind of close the coverage gap and really provide, at the very least, basic income security for older people. There's issues with adequacy. These pensions are often very, very low, but it's a really, really important step in terms of reaching those that cannot be reached by social security systems. And I think that's really in a way, I really think that social pensions are a very gender equitable response to an identified challenge of existing social security systems to provide coverage to older women. Sorry, can I ask a question? You are based in Kenya?
Yes, we are based in Nairobi. Yeah.
Okay, so Kenya is a good example. This is only up until 2014. But in 2017, the government rolled out a massive social pension for all older people. It's 70 plus at the moment, so that's quite high. But it is still, I think the first time that older men and particularly older women receive some level of pensions in old age. So this is, I think, is a really, really important step. And there's we're currently in the process of trying to have a learning agenda around this and see what are the impacts of it. But I think this is really, really, really positive step. Okay, I haven't really spoken so much about data, although I think that the picture that I wanted to paint is that both the analysis of the existing system, the analysis of women's life, and the policy response of having social pensions is based on data, and it wouldn't be possible without data around household surveys, around administrative data from programs. It would not be possible without any of those. So I think it's really steeped in a data analysis, and that's how I kind of try to bridge the conversation from social protection to data. But in terms of data availability, I think there's a couple of issues. In social protection, you distinguish usually between social security, which is the contributory. You pay a certain percentage of your salary. It goes to kind of a pension entitlement, and you have the kind of the tax-funded social protection that's sometimes also called social assistance. That is, the various cash transfers that are growing in Africa and providing poor people, vulnerable populations, or certain age groups, or certain, say people living with disabilities with at least a basic transfer, based on the understanding that this month that this is an incredibly important source of their income, and and can ensure kind of income security for those populations. So these are kind of the cash transfers, which you see obviously that Kenya has been very, very active at that, but other countries in the region as well. And I think it's interesting. I think there's very few policy interventions that are as well studied as cash transfers in sub-Saharan Africa. There's been a massive investment in research there. Sorry, I have to open the window. It's quite warm in here. London has been really warm at the moment. It's very confusing. But social security, we usually, pensions, old school pensions. We usually have administrative data. That means, kind of data on enrollment, on number of people that are contributing, number of people that are benefiting, their levels of contribution. That stuff usually exists, but there's access challenges. It's hard. They're not often publicly available. It's difficult for people to. It may be difficult for people to access those. And I think there's a point here that even in kind of the global flagship reports, these days the World Bank and the International Labour Organization and others have these like massive global and incredibly important reports on social protection. Even often when you really look at where you have good data, it tends to be European countries in OECD, and not necessarily countries in sub-Saharan Africa or in Africa in general. You have much patchier data, which has a lot to do with their social security systems not being quite as developed and robust. But it also means that I think a lot of the generalization, a lot of the findings we draw from these data are based on, essentially on a more developed countries. And I think there's a really point here around, and us not seeing them as maybe kind of as universal as they may be. I think in psychology, there's a term called weird, and there's a realization that much of, I think, psychology literature is based on experiments with so-called weird people, and that stands for Western educated, industrialist, rich, and democratic societies. So it's a particular subgroup of people, but they may not be representative for they're certainly not for the wider world. So the fact that we have this data on, or like we have much better data on some countries, I think may lead us, may make generalization not quite as strong as we sometimes think they are. There is another on the social assistance side, the cash transfer. I think data it's much more of a challenge, where you have less of a history of access. There's less of a sense of to data in official social security schemes, and there's more of a kind of discretional approach, right? So you have a cash transfer that may not be tied to a policy or to a law, and you should be lucky that you get it, but you don't really have a sense that this is a right that this program is realizing a right that you have protection, so that the data on social decision scheme is often much patchier, it's fragmented, it's harder to access, and there's very few places where normal citizens can access those. And I think that can mask inequalities and inadequacies of these programs at times. If you don't know who's benefiting from it, it would be really difficult for you to see. Okay, well, are women underrepresented? Is this adequate? Is this these analysis obviously relies on data, which may or may not be difficult to get. A positive example I just wanted to talk about here is Kenya has an online single registry. As an online website, you can go on there and you can find pretty good information on most programs. You can map it. Kenya has about 5 for older people, for children, orphans and vulnerable children, I think people with disabilities, and you can find information on that. So I think that's a really, really positive example of open data and okay, so good data. Now I think the caveat here for me is that I'm very interested in data and I work with data, but I'm not this is something that HelpAge as an organization that works to give voice to older people is very, very concerned with and very interested in. So there's colleagues of mine who work on this a lot, and I hope I'll do their work justice by just kind of referencing it right now. It's crucially important that the data, that first of all that everybody that everybody is counted, that you don't leave out population groups, or that you collect data in a way that you cannot disaggregate by population group, by age, by gender. Sometimes the sample sizes of surveys are too small for us to do that, and that's a real challenge. Because obviously the life of a 60-year-old man is not the same as a 85-year-old woman, right? As the life of a 15-year-old is not the same as a 30-year-old. So there's really real differences there. And one of the you're seeing right now is to remove upper age caps. Often you see population, what do you call these again? Population pyramids where there's kind of a flat ceiling on top, where suddenly you have 3% of people are 64, and then you have 10% of people are 65 or older, right? So that it doesn't really reflect or allow you to analyze the lives of older people. So it's crucially important to really connect those. So enable to of that. So if you don't collect data on older people, you are bound to ignore them, I think, because if you're not collected, if you're not counted, policy will not include. Policy will not be based on you, or you'll. I think it's crucial. There's an example here that the WHO STEP survey. I don't know when that was, but this is a recent infographic. So it must be relatively recent, where 34 out of 40 African countries did this survey, but did not include anyone over the age of. And obviously that shows you the scale of the challenge, and that really does highlight that if you don't, older people have their own needs, their own rights, their own challenges. They are in very particular situation that differs from men to women, and from kind of the younger old to the older old. But if you don't collect that data, you can't say anything that part of the population, which policy for them, or that the policy that you will design for them is wholly inadequate. Inclusive data charter. I remember that a colleague on the call was talking about this, so you will probably be much better informed about it than I am. But I think it's a good set of principles. I think it's come out of kind of the peoples with kind of the world of people with disabilities, but I think it's a good rule for and generally more inclusive data. And the principles here, there's 5 of them. I'm not going to go into much detail, but it says essentially, everybody must be included in data. If you're left out of data, you're very likely to be left behind in policy. Data needs to be disaggregated, because if you can disaggregate and describe populations, specifically describe populations, you can't really tell anything about their lived situation. Then so I think that's crucially important. And then there's the other principles about using as many sources of data as possible, strengthening the capacity of those doing the data collection, analyzing, and disaggregation, which I think is really important. And I think there's an interesting point here around kind of accountability, that there must be recourse for those. I think we sometimes see populations as kind of a passive group of people who we extract data from. They're kind of not even generators, but just sources of data, without including them in a conversation about or sharing data then in return with these populations and engaging in a conversation. So it's just kind of a one directional extraction, which isn't obviously helpful, and can lead to misunderstandings and bad data, because these people cannot be challenged, the data collectors. Right. So now I have just one more point, and then I'll share with you a few resources in the HelpAge world, but also generally the kind of which has, I think, good get data sources. So here's a point. This is something that HelpAge does in a few African countries, where we work with older people, and we help them to generate data in of itself, for them to be actively involved in data production and analysis, and to use that data to challenge and engage with government on the quality of services that are being produced. And this is there's some data we have online. I put the link in here if you're curious. I think it's Uganda, Ethiopia, Zimbabwe, Malawi. I'm not 100% sure, but you can check it out. And I think this in Kenya are put in a position or helped and enabled to take an active role in data creation. And I think it listening to other people and of can often service delivery, I think, can give you a crucial insight that a kind of more top-down data collection process couldn't. At the same time, from a social protection lens, it's really important that those who are, if you will, recipients or beneficiaries of program have opportunities to share their concerns and views and experience in these programs. Social protection is not a technocratic solution to challenges. It's a societal kind of process. It's a negotiation within societies about what level of protection do various population groups social protection should have, or where prioritization should be, and what's adequate and what's not adequate. So I think it's really important to also provide structures for affected populations, or from certain parts of the populations, to also share their voices and views. So then, just closing, there's going to be some slides now on some resources. Here is something called Pension Watch. It's a HelpAge social pension database. So around the world, you see a map. We've mapped all social protection for older people. So if you're curious about whether your country or countries you're working in or countries you're researching has a social pension, how many people are covered, what is the adequacy? Is this is this half the poverty line? Is it, what percentage of GDP per capita would this be? And you want to compare this between countries, this would be good resources to look at coverage adequacy and also cost of pensions. Just as an example, because I think you're also based in Rwanda, right? I looked this up. And I saw that Rwanda is currently working on a new social protection strategy, where one of the proposals is to implement or to harmonize a range of cash assistance program into a old age and person with disability grant. That's kind of more universal. So what I just plugged in some numbers here, how much that would cost, and you can kind of play with this data if you want. Then there's another thing I would like to share with you. It's called Age Insights, Age Watch Insights, where you have a host of data, of information on older people's lives, beyond income, but what is their health status, their life expectancy, and what is the kind of preparedness of a country towards aging. So just check that out. I figured that could be interesting for you since we're talking about data. And now this is the final slide. This is just, we'll share this presentation with you. This is just a range of databases online by the ILO, by the World Bank, by the OECD, various kind of global actors that have data on social protection and health, and as well as some guidance towards the bottom around inclusive data. And I think the 2 points here I'd like to mention here, and is that it's obviously incredibly important that disaggregation can be done along the lines of sex and age, and I'm talking about this acronym SAT data, sex and age disaggregated data. And there are these city groups. There's the Washington group for disability, and there's the Titchfield group for age sensitive data that are currently in the process, certainly the latter, currently be in the process of developing guidelines for better surveys that capture the reality of aging and older people. So this has been my presentation. I hope this has been helpful. Let me go back to the beginning. I have to say, unfortunately, I have to leave in about 10 minutes. I have a meeting with my CEO, so I really need to be there. But I would be happy to have any questions if there are any.
Yeah, thank you so much, Florian. That was amazing. It was a lesson in social protection as well as data, even though you say an authority on open data. But that was amazing. Thank you so much. I think your presentation really speaks to a lot of what we do, especially again when it comes to disaggregation of data based on sex. And at this point, I'm just going to plug in, one of the reports that we did really quickly before you go. So we have a portal where we're looking at sex disaggregated data, and social protection was one of the indicators that we were looking at. We're looking at SDG 1 to 5, and we looked at 19 Anglophone African countries. And that sort of resonates a lot with what you have said. The findings that we got